Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended reporting severe bilateral itchiness and irritation in both ears, and we call that psoriasis, in addition to reduced hearing. They'd been using quite a few over-the-counter drops, including hydrogen peroxide and also sodium bicarbonate drops. In addition, the patient did admit to getting water in the ear in an attempt to clean out this debris, and they were really struggling over the weekend and decided to book an appointment, and I just saw this patient yesterday. So as you can see, this is not earwax. It's more of an infection. They've got otitis externa, and more specifically, they have got otomycosis, which is a fungal ear infection. And that will be more noticeable in their right ear because you can actually see the fungal spores and hyphia, I think that's how you pronounce it, those little woolly white strands, which are just sitting on the surface of the skin in their right ear. In this side, there were probably a few black spores mixed in with the debris, but it's a bit more difficult to diagnose whether this is a bacterial or fungal infection. Now, the patient, interestingly, did advise that they, as a child, used to suffer from fungal infections, and the way they were realised that there was a fungal infection, they can vividly remember as a child visiting the doctor, and the doctor got one of the students in and asked the student to examine this inside of the ears, and the patient remembers the student making reference to the patient having some mushrooms or something similar growing in their ears, and that's always stuck with the patient. So with a fungal infection, it's so important that you keep the ear dry, moisture-free, and so the first thing I advise the patient is to avoid getting any water in the ear, so they regularly and purposely get water in the ear while showering and bathing in an attempt to clean their ears. And I explained that with moisture like that into the ear with water, it can provide the perfect incubating environment for fungi and also bacteria and other viruses to colonize and multiply and grow within inside the ear. So that's the first thing. So the most common cause of fungal infections are warm, moist, humid environments. Because the patient's ears are so itchy, they also admit to using cotton buds. And again, that's going to, it's easier said than done, me telling the patient don't scratch the ear when you've got an itch and it's a edifying itch that you really want to scratch. It's difficult to resist the temptation urge. So what I've advised the patient to do is, once they've got this fungal infection treated, just to have some acetic acid spray for the ear in the house. So whenever they feel that their ears are itchy, just to apply some acetic acid spray, which will hopefully just calm the ear down and prevent and obviate the need for the patient to put a cotton bud in the ear. So they're going to need an ear swab just to confirm the presence of a fungal infection, or sometimes you can have both a fungal and bacterial infection. And so I'm really happy with that. I can see the whole eardrum. There is a bit of debris just around the edge. I've got as much out as I can as safely as possible. Again, this patient's ear canal is inflamed, it's tender. So we're going to be really gentle and delicate. We don't want to, when your ears and the skin is inflamed and tender, it's more susceptible to damage. So we're just going to be very careful when we use any instruments, including the suction probe, because we don't want to cause any abrasions or cuts or lesions within the ear canal. So that's the left ear done. And now this right ear, you can see it's a bit more spores. You've got this kind of almost like black mold developing on the surface of the debris. So we're just trying to remove this, but the ear canal was quite inflamed. I'm just going to go back in with the endoscope to really stretch open the ear to provide access for the instrument to go into the ear. And we're going to remove this in a moment. On the anterior canal wall, so the right hand side, you're going to see the hyphia. I apologise if I not pronounced it correctly. My pronunciation is not always great. But these little white woolly strands, I don't know if you can see that just on the right hand side. and you'll get a clear review in a moment. Again, this is far more inflamed, swollen. The eardrum's fully visible already, so the patient can hear significantly better. I'm just going to spend a bit of time now to remove as much debris as possible. I think there was still some residual debris just at the roof of the eardrum, but we actually went onto the eardrum and kissed the surface, and it wasn't coming away. So we got to quit whilst we're ahead sometimes, because if I persevered any more, we may have caused some trauma to the eardrum, which is the last thing we want to do. So you can see the black fungal spores here, in addition to the white woolly strands. So we know, because this patient's got fungal spores and these white woolly cotton wool look-alike strands, that they've got definitely a strain of fungal infection called Aspergillus. Now you can get Aspergillus niger and flavis, which grow in the ear. They may also have some candida. So candida is a bit more difficult to diagnose, but typically with candida, it's a bit more thick and creamy, just more like the left side. And also there is some thick, creamy discharge here. So they may have multiple strains here. And they may also have mixed in some bacterial infection, but hence why I just want the patient to obtain an ear culture swab, so they're prescribed the appropriate medication, ready written to the GP. I've started them off on over-the-counter antifungal treatment already, because that's going to be the most likely strain that they've got here. Aftercare, avoid water, avoid cotton buds if at all possible. I know this patient was saying it's so easier said than done, and hence why I've recommended the Ear Calm, which is the UK brand of acetic acid. I've actually advised the patient against olive oil to help moisturise the skin naturally, because there is evidence that, or when I say there's evidence, I've read an article written by an ENT doctor who advised that olive oil can actually make a fungal infection far worse, because the fungi can actually feed on it. And as such, I've just taken that advice on board. So we're just mopping up around the edge with the fine end. Just to give you an update, guys, so I've just head back from the TV channel. I should be going live next Tuesday, all going well. So just got a meeting on Thursday, so I'll keep you guys updated. So that's very exciting. And we may be performing a live procedure. We're just trying to work out how that's going to work, but a bit daunting, but I'm up for the challenge. So this is some of this residual discharge at the top. It's really thick and creamy, and I could do no more really if I'm actually touching the eardrum, and if it's not coming away, it's not coming away. No, we don't want to wash this out with water, because that's going to just exacerbate this patient's infection. As I said, the main causation of a fungal infection is warm, moist, humid conditions. Now, hopefully, now that the patient's got a bit more of an idea of what's causing their psoriasis, itchiness and irritation, and how to best look after their ears in general, I'm hoping they can keep this at bay now. But with fungal infections, they are quite difficult to treat, and they're quite resilient. They tend to spring back. So I've asked the patient to ensure that they are able to revisit their doctor post-treatment, because quite often, because of the resources in the UK, patients are not always followed up with the ear infection. So the patient themselves may believe that the infection is clear, but it's not. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.